morning. I hope you can hear me with our face masks on. We're following protocol for our campus and for learning safely during the virus outbreak. I'm Reagan Blanchard with you again. Today we are with Miss Dallas Collins, and she is an instructor in our CNA program, and we're thrilled to be here to chat about our Certified Nursing Assistant program. You can get started as soon as Monday. So Miss Dallas is going to tell us all the great things about a career as a CNA and how OC Tech prepares you for that field. So we'll start chatting. Miss Dallas, tell us a little bit about what a CNA is and some of their job duties.
All right. A CNA, a Certified Nursing Assistant, is someone who is actually an assistant to the nurse, doing things that the nurse assigns her to do. They learn things like how to make beds, how to take vital signs, how to transfer patients, lots of different skills that they can learn to do. They can work in a variety of settings. Our clinical has to be in a nursing home setting or long-term care facility per our Department of Health and Human Services guidelines, which is our accrediting agency. But once they get out, they can work anywhere that they choose. They can go to a hospital, they can do private duty, they can do home health. Basically anywhere that hires nursing assistants, they can go to work.
Great. And tell us a little bit about the length of the program.
Well, due to COVID-19, we've had to make some changes for the summer, so it's going to be 9 weeks, and it's going to kind of be crunched together, as I call it. But I think we can manage. But generally, it's a semester long, so we will start another class in August. They will finish in December. We'll start one in January. They'll finish in May, and then hopefully by next summer we'll have the regular class times again. But it's generally what we call a semester in length. Prior to the COVID-19, we also had where they could go ahead and take the state test within that semester as well to be certified. So we worked that into the schedule. They would take that at the end of the semester. Right now, all testing has been canceled nationwide. So our students that are finishing now are just waiting for me to get word that they can take the test and come back in and test. But until these conditions came about, you could test at the end of the semester.
Right. And a little bit about the class format. What can they expect when they're with you learning and in the lab? What kind of things will be part of their curriculum?
Without COVID-19, we have some lecture and some skills. I'm not the kind of person that lectures all day long. Our classes are long. So we have generally a little bit of lecture in the mornings maybe, and then most of our class time is geared toward working in the lab, toward doing the skills in the lab. The first day or two is kind of the most of the lecture things on things that are not skills. The others are related to skills, so I may lecture, say 30, 45 minutes or an hour, and then we spend the rest of the day doing skills, practicing skills, demonstrating skills, and then they do check-offs. They have to give back to us what we've just shown them. And then at the end of that, then they go to clinical and practice. They practice on each other in the classroom and or mannequins, and then in clinical they practice on real people.
Great. And in a nursing home setting, for example, if I'm a CNA, am I doing blood pressure checks? Am I helping them with daily tasks or moving them about what they need to do while they're there?
It depends on the patient. The nurse would assign a patient or a resident to you, and it depends on what that person needs. Typical day in the nursing home, we would get there in the mornings, I would assign you your patient, tell you what you have to do for them. So you might have Miss X today that only needs what we call standby assistance, meaning she does most everything for herself, but she just needs somebody in there with her. Or you might have Mr. J, who is what we call total care, that does nothing for himself. So you technically could be bathing him, feeding him, dressing him, putting him in his wheelchair, taking him to activities, taking him to the barbershop is there to cut hair. You might take him to get his hair cut. Just whatever he wants to do. But any task that that patient needs that day, you would do for that person. Vital signs, if it's the day they need vital signs, you would be taking vitals. You might give a shower, you might give a bed bath, depends on what they need for that day.
And a CNA for us also can be a stepping stone to some more of our nursing programs. Can you talk a little bit about that?
Yeah. We're under the umbrella called PCT, which is CNA, ECG, and phlebotomy. Many of our students will start in the CNA program, and then they want to go on to ECG and phlebotomy so they can earn that PCT certificate. They can also earn a certificate in each of the 3 parts of PCT. So when they finish my program, they actually can get their certificate saying they completed the course for our Department of Health and Human Services guidelines. They will also, if they have completed English 155 or 101, one of the English classes, they will get the certificate from Tech saying they completed the CNA course for Tech. Nursing also accepts the CNA certificate and the state exam. If they pass that, they get points for that if they're going into the nursing programs. I found in all the years I've been here, if a student starts out here first and then goes into the nursing programs, they're more likely to be successful because ours is a short-term program. And basically what we do the first semester is the same thing they do the first semester in nursing. So, you know, everybody wants to be a nurse, and if you get in here and you want to be a nurse and then you don't like what we're doing in here, you don't need to really waste your time, I don't feel, doing all the requirements you have to do to get into the nursing programs, because if you don't like what you do in here, you're not going to like the nursing program. So, you know, you haven't spent a whole lot of time to get in here versus going into the nursing program. You've got a lot of things you have to do. So, good stepping stone, and we see, I think, much better success if they start out here first.
And if I have my CNA certificate, can I work while I'm working towards maybe some other certificates or want to be in other programs?
Absolutely.
We'll come back to that question. We're going to do a quick tour of the lab. Ms. Dallas has a call she needs to take. Oh, false alarm. No.
Just see me. Hi. Okay.
Good. We have lots of staff on campus today, so we have some folks popping in to say hello. We are operating in full capacity in a lot of ways, getting prepared for our students to start Monday. But tell me about how I can work while I have my CNA certificate and do other programs.
A lot of our students will get their CNA certificates, and then they can work part-time on the weekends, or, you know, whatever fits their schedule while they're still in school. And the good part about that is that it gives them experience, particularly if they're trying to get into the nursing programs. They get a lot of experience in these places, seeing what the nurse does and how they do things differently than the nursing assistant does. So, yes, once they are certified, they can go to work anywhere.
Wonderful. Wonderful. And what are some of the precautions we're taking with COVID while they're in such a hands-on environment?
When this all broke out in March, we were fixing to go to clinical when we came back from spring break. Of course, all that did not happen. So we did initially I had some things that we usually do, what I call post-clinical conference, after we've been in clinical activities and things. I converted those, put them online for them to do for their clinical portion. And then we've just been back these last 3 weeks actually doing the simulation of skills. Since we could not be in clinical, our accrediting agency said that we could, if, you know, we could come back on campus, we could just kind of go through the skills again that we'd already done in class to prepare them for clinical, to count that as their clinical time. So that's what we did. In the classroom here, of course, you see the little stars on my desk here. That was the social distancing for students to be in here. And then you see the different mannequins. We had 3 or 4 instructors in here, one of us in each corner with a mannequin. And then a student will come to us one-on-one and redo their skills or whatever we had planned for that day. Them on one side of the bed, of course, us on the other side of the bed. And so it really worked out well. I had 3 classes of students that had to, what we call, finish the course, finish clinical. And it really worked out well for, you know, as far as the social distancing, having them in here, having us in the mannequins, and then of course we would clean the mannequins after each person. And they of course had to wear masks and make sure they wash their hands when they come into the lab and when they left the lab. So it worked out really well. A little bit difficult for us as instructors, having to figure out how to do things simulation wise versus the real patients, but we worked through it. Everything worked out well.
Right. And everyone's getting a good crash course in proper PPE.
Absolutely.
And how
Absolutely.
to prepare and wear the proper equipment
Yes,
to be.
and that is actually one of the skills that they learn in this class, is PPE, and so they'll get a good course in that when they come in. Probably better than we've had in the past.
Yeah, things are certainly different.
They are very different for all of us. Yes.
Great. What are some of the success stories you hear? Do you hear from your students about how much they're enjoying their career in CNA and being with patients?
You do sometimes. Unfortunately, we don't get a lot of feedback. The most I get feedback from are the ones that maybe go on into the nursing program, and then I see them on campus.
Yeah.
Or, some of them will go on to ECG and phlebotomy, and some of them are working, while they're in those classes. Some are not. But I've had, over the course of the years, quite a few students who have said, thank you so much. It was a building block or stepping stone for nursing, to let me know, this is what I want. I also have had students, and I'm honest up front, first day of class. I tell them, not everybody can be a nurse. And I tell them, be honest with yourself. If this is not what you want to do, come to me and tell me. You have to have patience and understanding and caring. And I've had students go through the class and then get to clinical and come to me the first day and say, this is not what I want to do, Ms. Collins. I don't want to be a nurse. Be honest with yourself. You have to have compassion and care in this. And if that's not what you have, if you can't go from a patient looking at you and smiling at you and saying thank you 1 minute to the next minute they're wanting to hit you and say ugly words and what have you, if you're not able to deal with that and understand that that's the patient's disease process, not the patient, then healthcare is not where you need to be. So, we've kind of had both the success stories of people that are doing this. I had a person that was in my program. I've actually had two people in my program. One of them went on to be a caregiver for my grandparents, and was excellent. And I expect excellence, and she was an excellent student. And once they passed away, she said, Ms. Collins, I appreciated that. I think I'm going on into nursing. She is a nurse now and does an excellent job. Right. I have a special needs brother, and one of my students in here went to work at the resource center where he was and had him for years. And she was their top-notch caregiver there, even won a state award. Wow. And it all started here in the classroom. So, those are just two personal success stories. Sure. And it means a little more when you've got a personal success story you can share. Sure. So, we do hear those occasionally, and then occasionally people find out it's not what they want to do. Yeah.
Oh, you'll love our facilities on campus. I'm going to give you a quick tour, but we have a 10-bed CNA lab. So you have a lot of experience. We have some juvenile patients. There are some patients of different sizes. And you really get a good experience on how to work with multiple groups of people. We are with Ms. Collins. If you're just joining us, she is our CNA instructor. We have our summer session starts Monday, and we do have space in the next class. Is that right, Ms. Collins? Yes, ma'am. So that you can find us on the website, octech.edu. You'll find our admissions page, and you'll want to get in touch with our admissions area to get enrolled for our Monday class. You can begin as soon as Monday, and in 9 weeks, which is going to be our summer session, you'll have your CNA certificate if you successfully pass your exam and can go to work with your CNA certificate somewhere in our great community. Anything else you'd like to add, Ms. Collins?
I will say at this point they will get their certificate from Tech. They may not be able to test yet, but as soon as testing opens back up, they would be able to test and go to work then. And I'd like to say this is not brand new to me, but brand new to students coming in. I have taught in this lab before, have been out of it, and we have just moved back in this lab. So we're excited because it is bigger than where we were. So I've got great things planned. I will say that the class starting Monday, the lecture portion will be online. The clinical or the lab portion will be here face-to-face. So they will still be coming here, but maybe not, every day. Sure. I'm not sure what they're seeing out there, but just to clarify, class will be Monday, Tuesdays, and Wednesdays. Mondays from 8 to 3, Tuesdays and Wednesdays from 8 to 1. Now that may not be the entire time each day due to some of this lecture having to be online. I'll be posting calendars and date and times when they need to come to the classroom, and instructions on how to meet us and what they need to do at the door to be able to come into the lab to do their skills, because the lecture will be online. The lab you can't, or skills you can't have that online, so they will be doing some lab work as well. So it'll kind of be a combination of things for the summer.
Great.
The other thing they get in this program that is a requirement is CPR and first aid. All students have to have that for any of our health science and nursing programs. So I teach that as well. I have 2 lab assistants that help me, depending on the number of students, for both CNA and for CPR and first aid. But we teach that as well, and those classes will be sometime in July. And we'll sign them up for those classes as well. So they'll have that too.
Sounds like you'll be well prepared. Let's do a quick tour of the lab to show you this great facility we have. A nice open space, and as Ms. Collins mentioned, we have the yellow stars on the desk so that the students are spread out to follow CDC guidelines, but also the guidelines we have in place with the college during this time. We have mannequins of different shapes and sizes, lots of beds that are really mimicking what you'll experience when you're in your work environment in full-time work as a CNA or patient caregiver. The room is set up just as you might encounter in any facility. We try to keep our nursing facilities as similar to what you experience in your work environment as we can. We really want to mimic that hands-on process.
This is the table here. I left supplies out for this. This is what we've been using for the last 3 weeks, doing the different skills that we do with the students. So this is just an example of some of the supplies here that we use in the classroom. This over here is kind of a unique thing too that helps you to learn blood pressures. If you see the 2 boards here on the wall, this is one of the things, one of our teaching devices or teaching tools too, that we use to help students learn blood pressures.
Great.
Before they actually start taking them on each other.
Great. Very good. Wonderful. Well, like we said, if you'd like to get started on your journey as a CNA, we do have space in our summer class. That begins Monday, so you'll want to get in touch with our admissions department. They are working on campus and available this week. So follow our website and find our admissions department, and that'll take you to an individual who can help you get signed up. Thank you so much, Ms. Collins, for your time this morning.
Thank you.
We're glad to have you. We hope that if you have any questions, post them in the box and we'll get them answered. We look forward to seeing you on campus and hope this might be of interest to you and a nice change during this unpredictable time. Everyone have a great day and stay safe and well.